Hi, my name is Lingus, and today I'd like to talk to you about septate uterus and how it can trigger late miscarriages. Septate uterus is a congenital uterine malformation, which means you are naturally born with this type of uterus. And this type of uterus has a membrane or a septum that is growing from the top of the uterus all the way towards the middle of the cavity. So if you look at the image here, that you can find out that this type of uterus has insufficient uterine volume, and then it can trigger both recurrent early miscarriages and also recurrent late miscarriages. In an early pregnancy, if the embryo has implanted itself anywhere near the septum, there are far more connective tissues than muscle tissues in this area, and this will lead to very poor blood flow, which means the embryo will not get sufficient oxygen and nutrients, affecting its development and potentially can lead to embryonic demise or a recurrent early miscarriage. In a late stage pregnancy, because the fetus is now sufficiently large and needs a lot of room, but because of the insufficient uterine volume, this will exert immense pressure on the pregnancy and potentially lead to a pressure-induced late miscarriage. So here in Antai Hospital, diagnosis can be done easily using a hysteroscopy, hysterosalpingography, which is just an X-ray imaging of the uterus, and also a 4D color Doppler ultrasound to accurately assess and take a look at the shape and size of the uterus. So if you are diagnosed with this condition, here at Antai Hospital, we will use our standard cold knife technique surgery to surgically remove this septate and then use our intrauterine pear-shaped stent to restore healthy shape and size of the uterus. Now, if you also have a history of miscarriages or an induced abortion, you may also have developed an immunological factor which triggers recurrent immunological miscarriages. If you do have these conditions, you can sign up for a contractual treatment at Antai Hospital. If you'd like to find out more about uterus septate and how we treat it, please refer to the article below. Or you can find the link to the article in the description box.